The Right Hospitals Private Limited, Chennai, is happy and proud to congratulate the Association of Plastic Surgeons of India, who celebrate the World Plastic Surgery Day through the Sushruta Film Festival, and to educate and to make aware the public that how the plastic and hand surgeons help the human beings to sail a good life in their career. This gives an awareness how the surgeons' technical help these patients to have a normal life. As a reconstructive hand surgeon, I want to give the awareness to the public that 1 in 600 live births have some congenital hand differences. What we mean by the congenital hand differences is the birth defect in the hand. This may happen due to many reasons. This hand may be fused or separated widely, or there may be absence of thumb or duplication of thumb, or the whole hand may be deformed like a radial club hand, or what you call this as the club of the golf game. Sometimes the hand may be totally absent, and these hands has to be reconstructed for the children to develop in their life. Normally, it is told that this sort of hand differences has to be repaired before the age of school going. But now the concept is that these children should be operated before the age of 1 so that they develop a normal technique without doing their activity in a misled way, because the hand difference will make them to adapt to different positions. Before they adapt to any particular type of hand position, repair of these structures will give them a good hand and make their life better and make the patients feel better and happy. Thumb is the king of the digits, but it has got lots of differences. There are 5 types described, wherein the thumb may be small or it may be misplaced, not in the proper position, and sometimes the underlying bones may not be well developed, and the good opposition of the thumb is lost in many of these fingers. This we call it as the thumb hypoplasia. Here I like to show a child with hypoplasia of the thumb. The thumb length is short and it placed not in the normal position. Now, next picture shows you a reconstructed thumb with which the child can adapt himself and be able to pick up pebbles and put them in the proper place. This type of reconstruction helps the child feel better, happier, not to go for an adaptive movement, and the children also happy. This is how we reconstructive hand surgeons make the people happy in their lives. Now I like to show a little grown-up girl. At the age of 6, we saw her with a hyperplastic thumb, which is kept not in the proper place. We lengthened the short thumb with the help of a phalangeal transfer, and we have used the available tendon to suture to the transferred phalanx. With this, she is able to oppose the thumb, able to hold a glass, able to make a good handwriting, and they never came for even motorizing the thumb. This is a good result for the child, and the patients feel happy and their lives go well with this reconstruction. Now see this hand. The hand is kept at right angles to the forearm. Looks like the club of a golf game. That's why it's called normally radial club hand, because it looks like the club of a polo game. Now this has to be reconstructed by straightening the hand to the length of the forearm. Once we have done that, then we reconstruct the thumb by using the index finger of the child, and this will give the child a usable thumb and a valuable thumb to have their continued activity in her life. This is how we make the patients live happily and also the parents feel happy throughout their life. Now you have been so far viewing the hand differences or the birth defects of children. Now I am going to show you a picture where the child got injured her cervical nerves, so the child developed birth palsy or a neonatal palsy while delivering. While delivering, the baby is big. It is very difficult to get the head and the body out. So the gets stuck at the level of the pelvic rim of the patient or the mother, and with difficulty they take out the child. It results in the severance of the nerves of the brachial plexus. This results in a palsy of the hand. If the child is brought in a proper age, that is before the age of 6 to 9 months, we will be able to explore the neck and repair the nerves and make the child to move the hand as you see here. And this particular child, once she has grown up, she came for review and for the further surgeries. That time she was so happy in her own hand, she drew the diagram of mine and said, "Good doctor, I am happy. Because of you, I am using the hand well, and my parents are also happy." This is what the role of the reconstructive hand surgeon in treating the children having birth palsy too. The children should be operated and should be taken up for surgery at the proper age, which will give them a better outlook, and they don't adapt abnormal movements, and they will be happily going to the school and where they may not be ridiculed by the other children. Parents are also very happy that the child has got a normal hand, able to write and do all the work as other normal children. Thank you very much.